Good morning, everyone, or afternoon or evening, depending on where you're joining us from in the world. It's wonderful to see you all. We're just going to wait a few moments before we start to let a few more people join. As you'll have seen in the chat, just pop a little message in there to introduce yourself. Let us know who you are and where you're from and any interest that you've specifically got in joining today. Welcome, everybody. Great to see people here from literally all over the world. It's wonderful. I will start us off today then for the first session, the launch of our research focused Global Solutions Initiative. And I must say, I'm really excited about this opportunity for us to share these insights and experiences around the whole agenda of research and how it's so relevant to our nursing professional identity, our presence, and our influence. For those of you that have not met me yet, I'm Gemma Stacey. I'm a professor at Nottingham Trent University, but also the Programme Director of Nursing Now Challenge. And I just wanted to introduce today's launch event of this particular Global Solutions Initiative with some reflections around where I see the role of research within nursing as a profession on a global level. And really to emphasise that for me, research literacy is absolutely central to our identity as nurses. And the reason I say that is because research often enables us to have influence. It gives us power and evidence to be able to bring our views, our opinions, our insights from our practice into influential spaces. And it enables us to show that it's not just our experiences, it's also the evidence base that is really highlighting the particular area that we want to progress and influence. But it also enables us to ask really important questions as nurses. So where we see either gaps in practice or a way that something is happening that we feel uncertain about, we're able to reach out to the evidence base to understand what that evidence is telling us and to allow that to inform our practice. But even better, it allows us to ask those questions and then think, how do I create the evidence to be able to answer those questions? So it enables us to make sure that our everyday care is evidence informed, that we are drawing upon what the world is telling us is the best way to support and care for our patients. And sometimes that can matter on a day-to-day basis. I remember as an early career nurse being able to use evidence to advocate for a patient and the direction that their treatment was going within a mental health setting, and really to be able to challenge a more medicalized approach in favor of more social model for this particular individual. That wasn't just based on my opinion, it was based on me knowing what the evidence base was saying around that particular area. But it also enables us to raise our voice, to be able to hold authority when it comes to influencing either in our own organisations, with other professional groups, and even on a regional, national, or even international level. So being able to draw upon the evidence base to inform our policy as well as our care is really, really important. So today's launch of this Global Solutions Initiative is going to be led by Dr. Ada Hui, and I'm really privileged to have known Ada for many, many years. And Ada really just embodies everything that I've just described. I remember Ada approaching the dissertation that she undertook on her undergraduate nursing preparation and seeing it as a huge opportunity to really deep into that particular area, to become the expert in that space and to read and inform herself, so that she was able to really produce an outstanding piece of research. And it wasn't unsurprising to me that research then became a focus of Ada's career moving forward, because that curiosity and that drive for knowledge became really central to Ada's identity as a developing nurse at that point. And then several years later, she's now in the position of Director of Research at the Royal College of Nursing, which is just phenomenal. So thank you, Ada. Thank you to the panelists that you have brought to us today. I'm sure that you'll make space for them to introduce themselves. And we're really looking forward to the insights that you share with us today and through the rest of this Global Solutions Initiative. So over to you, Ada.
Thank you so much, Jen, for that really heartwarming and really kind and generous introduction. I'll just share my screen so that you can see my slides. So just bear with me a moment while I get those up, and hopefully you'll be able to see those shortly. So I'm absolutely delighted that you're all joining this morning, and a very warm welcome to you all as we launch our brand new theme that is around global research. And today we're focusing specifically on the power of research with a wonderful panel of guest speakers who are doing phenomenal work in so many different roles. For me, at the heart of nursing, health and social care, midwifery, and research is having a thirst for knowledge and a hunger for change. So, thinking about what is it that you're really curious about, thinking about what kind of things do you really want to change, what do you want to champion, and also thinking about, well, how do we go about doing this? So for me, at the crux of all of this is thinking about, well, actually asking those curious questions, having that curiosity, thinking about challenging and re-challenging and being open to challenging ourselves and our personal assumptions as well. All of that breeds new knowledge and new ways of doing, thinking about things, and new ways of action. So those actions and that curiosity and that new knowledge then brings about the possibility for change. And I think whenever we talk about research, evidence, all of those things, what happened 10, 20 years ago, or even last year, things continuously change. And so we're constantly needing to learn new things, new ways of growing, new ways of being, so that we can keep right at the heart of the action in terms of thinking about best practice. So, as nurses and midwives, we so often talk about the importance of evidence-based practice, but actually that's the end point of research. So what we're really wanting to bring about as part of this research theme is think about, well, what happens at the very start? How do we really get engaged with research and get engaged with research at different points as well, which we'll be talking about throughout the course of these webinars. And just think about how we engage in research in different ways, at different stages of that process, and how we also become leaders within this space. So all of this knowledge, all of these actions then bring about the real potential to save lives. And we save lives, we improve the quality of people's lives in so many different ways throughout all of these processes. And that's what I really want us to encourage us to think about throughout these webinars. Think about, what is it that you're passionate about? What is it that you're genuinely curious about and want to change? Whether that's around education, policy, practice, further research, all of those things combined, they really are at the heart of what we do. So in terms of this research theme, we have a whole series of different webinars. So we've got the power of research today. We've got our second session in a couple of weeks, which is all around myth-busting monsters. And this is around dispelling the myths and misconceptions around research. So do ask any questions around, what it is that you want to learn, what is it that you want to hear more about, and I'd really encourage you to use the Q&A function. So please, if you've got any questions, please do put those into the Q&A box rather than the chats, just so because it's going to be easier for me to filter those out towards the end of today's session. Our third session is going to be riding the roller coaster. And that's about recognising that research is very rarely straightforward. So thinking about the challenges ahead, but also thinking about the potential. thinking about research ethics, what we need to consider, how we ensure that we are genuinely inclusive in the research that we do. And also thinking about the emotions associated with research as well, because in terms of emotions, especially when we're researching sensitive topics, that can be quite challenging, both as a researcher, as a nurse, as well as actually for the participants that are engaging in research when they're telling their stories, talking about their lived experiences. So thinking about how we manage all of those different dynamics and build research in a sensitive way. And then our final session will be leading your legacy. And that's an opportunity for you to really think about what it is that you want to grow and shape and change throughout your career, how you might go about doing that, and also to talk about the potential of you writing a research proposal so that you can be entered into our prize. So, whilst we're really open and welcoming to everybody to engage with these research webinars, no matter which stage of your career, to be eligible to submit your to be in with a chance of winning our prize, you must be either an early career or student nurse or midwife. And what we're asking you to do is to submit a short research proposal around 2 sides and certainly no more than 1,000 words. And this will be for you to identify a topic or a core issue or focus that you can really build and design and shape within your current practice or workspace. So to identify what your topic is, and that can include a series of research questions or aims or objectives, for example. Setting out the details of your research design. So how are you going to go about doing this? What are your research methods? Who do you want to engage with? Which participants or populations? And then thinking about how you're going to disseminate this work. So we talk about the importance of knowledge exchange, how to get your work out there, whether it's through publication, attending conferences, writing blogs, speaking to podcasts, whatever they might be. So that's going to be a short piece of work to begin with winning our prize. So our prize will be to fund for your full place to attend our Royal College of Nursing International Nursing Research Conference. And this will take place between the 15th and 17th of September this year in Glasgow. So please do save the date and make sure that you're free. And this will give you an opportunity to engage with our most up-to-date contemporary thinkers within the research space, and for you to have the opportunity to present your work as well. So that's a very short snapshot of what this research theme aims to do. And I would really like to introduce our guest speakers for today. So we have Dr. Yakubu Salifu, Dr. Rosalie Magboo, and Dr. Zena Aldridge. So I'll stop sharing my screen to allow our first speaker to present. And as Dr. Yakubu is about to share his slides, I'd really like to welcome Dr. Yakubu, who's going to be presenting his research from clinical questions to global impact. Dr. Yakubu is a nurse, lecturer in palliative care, and researcher at Lancaster University. His work focuses on family caregiving, masculinity, and equity in end-of-life care, exploring how culture, gender, and social context all shape access to care and help seeking, particularly in low and middle-income countries. He is also the CEO of Compass Ghana, so a very warm welcome, and I very much look forward to hearing and learning more about your work. Over to you, Yakubu. Thank you.
Thank you very much for that warm introduction. Can you hear me?
Yeah.
Yeah. So I'm really delighted to present my work in this session, and I'm really delighted to share my clinical questions that I have that perhaps I think is making some significant impact. So you've already introduced me, and that's really nice. So I think that is what I would just want to add is that I'm also a gardener. I love farming a lot. So just to kind of begin, when I started my PhD, I had my clinical question that I wanted answers to. And why did I want answers to those questions? I wanted answers to help shape policy, improve practice, and also, improve education in Ghana. And I'll swing back to this later on to kind of give much more information on that. So to me, it's a bit of a comeback, really. So I must say that I was part of the team who, launched the nursing nouns, I think in 2018 in London. And it's really, really, I think has also helped shape my thinking around what to do to kind of improve, clinical practice, to improve, evidence base for policy and also education for nurses. And it's my hope that my story that I'm going to share, my research story, might be very useful for others as well. So just a bit of information about my PhD, which I did at Nottingham, and that's where I know Aida. So my PhD explored the experience of men living with advanced prostate cancer in Ghana. And just to kind of give you a little bit of snapshot, Ghana is almost the size of the UK in terms of landmass, but the population is around 30 million. We do not have hospices and we do not have institutional palliative care services. And that what meant is that the family caregivers become, the central in kind of providing healthcare for people with palliative care need. So that clinical question led me to my PhD, and these were the key findings that we had. Home-based palliative care was unsupported by health staff, and that was a lot of a challenge. And like most, developing countries, the issue around cultural response to illness was very, very, very important. And key among them was masculinity and stigma, and also the issue of care in a resource-poor setting. I will unpack some of these things later on. So even before the end of my PhD, I wanted to change practice and also policy. So with the initial findings of my PhD work, I set up a charity which was called Prostate Cancer Support Heritage. Pro-cash for sure, but there was nothing cash about that. I was using my own stipend as a PhD student to, fund most of the activity. And this became the precursor of Compass Ghana, which I'll be talking about later. One important thing that I want to share with, participants is, the need to take opportunities that comes your way. So during my PhD, I did attend a number of, international and national conferences. And the aim was to kind of, learn from people, network with people who matter within the nursing
to pay it, to be fair.
Can you hear me? So these conferences was really, really important in shaping my kind of research journey. I did also participate in organizing conferences and, in a few occasions winning awards, and, that served as a motivation for me to really kind of move ahead with my plans. And just to kind of say, one of the award perhaps was one of the turning point for me. This was a conference in Brussels in 2018 that I delivered, presenting my initial findings from my PhD. And to me, I think I was very worried that there wasn't institutional palliative care services in Ghana, and that the family caregivers were the central, kind of healthcare team for the patient. However, that even seemed to be, enough solution, because most people believe that, there were some kind of motivation to move from institutional caregiving to home-based care. So that kind of changed my perspective. How do we move beyond the Western-centric, perspective about palliative care? Because as we are all aware, some of these things are context specific. What may work in one country, especially in westernized context, may not fit within, a non-Western context. So based on my PhD findings, we decided to, fashion out what will help. How do we support the, healthcare staff who are unsupported? How do we respond to the cultural issues around masculinity, stigma that serve as a barrier to delivering care? And how do we enhance some of the already good practices like family caregivers providing care within the home context? So the main issue was that we're using research to influence local practice. And this is a kind of a snapshot, very quick, about palliative care data in Ghana. Almost about, 85% of the people have no access to palliative care. Average age of death is around 63. And from the time of being diagnosed to the time a patient referred to palliative care team to their death is about 5 days. So, and Ghana do have a health insurance, a bit comparative to the UK, but you need to register with the health insurance to, to access healthcare. And one other disadvantage about our health insurance is that it's kind of, it has a basket, it covers some diseases, but not others. So you may have the health insurance, but if you have, let's say, prostate cancer, or maybe you have other, palliative care condition, it is not, covered. And of course, because of the salary that people, also receive, a lot of people migrate outside, and that kind of worsen the plight of, people. So these are no movies. So these are, healthcare professionals who are trying their best to reach the unreached, in the communities, in the hinterland. So the main issue that I'm portraying here is not about the difficulties, but it's about the desire of the healthcare professionals to go any length to help the patient. So that became one of the central areas that we thought we needed to do to help people. And just to quote Ari Hedgeson and colleagues, palliative care is no longer a luxury, but it's, a necessity. So based on some of the work that I've done, and I love this paper from my PhD, my wife is my doctor at home, and that encapsulates the central role of family caregivers in the provision of care at home. The family caregivers are unheard, they are unseen, and mostly they are not, supported. And also to quote, Nigel Krebs, who used to work with NHS England, he said, the home is health is made at home and hospitals are for repairs. So in that instance, we need to support the family who serve as a support system in such a setting. I also talked about the issue of culture. Although not all the cultural practices serve as a barrier to care, because with the issue of masculinity, men believe that they are the head of the family, and where they need care and they are to be provided for by others, they see it as breaching their, masculine role. They see themselves as the provider for the family, but not the other way around. So some of these things may, influence the way they seek care and care is delivered. However, there are some of the cultural issues that were also very important for the delivery of care. One of them is the filial piety. People believe that it is their responsibility to provide care for their, family, their family members at end of life. And one of the cardinal things that, in Ghana is that if your parents, take care of you for your teeth to develop, it's your responsibility to take care of their teeth to also fall off. And that shows how people are, very passionate about some of these things. So as I've said, the healthcare system in Ghana is ad hoc. These are samples of, kind of a call for people to donate to their care. And as a result of that, sometime by the time people get money, they might have died. So the pictures that I've shown here, two of the boys, they died, even before they could get the support. Now we know that the national health insurance is, increasing its, coverage. The government has set up what we call the Ghana Medical Trust Fund, which is also helping. And of course, some, charities like Compass Ghana is also there. And that is the focus of Compass Ghana. So Compass Ghana is Compassionate Palliative Services for short. And this is a two-way charity that developed from my PhD work. One arm is registered in the UK with the Charities Commission. And you can see on my left on the screen, those are the trustees for the UK arm. And on my right, you see the Compass Ghana NGO, which is the other arm in Ghana. What the UK arm does is to solicit for support, have oversight responsibility. And the Ghana arm is the operation arm delivering care. And at the bottom is what I would term as the three musketeers, myself, Katie, and John, who are the co-founders of Compass Ghana. So we've done a lot of international engagement and research. And as you can see in the picture, we've, been to Ghana with colleagues from Lancaster University. We've been to South Africa, several fora to kind of, make sure that we advocate for, for palliative care. We've done, a lot of innovation and empowerment by using what we call a whole system approach. So we educate, we train people. We believe that, and based on the findings of the research, how do we empower the people so that they take their destiny into their own hands? And we involve the traditional authority as well for a buy-in. And you can see on the right side, John with a group of people trying to map out where to go and what to do at what point in time. One of the highlight of our activity is that we, working with Lancaster University, we invited people online to do a course about palliative sedation, just to kind of see the appetite. About 35 healthcare professionals did attend. After that, we invited colleagues from Uganda, Hospice Africa Uganda, to Ghana to train them, 4 of them for 3 weeks, all funded by Compass Ghana. The initial plan was to send people to Uganda, but later on we said, do you know what? Why not bring in the Ugandan people so that they can, provide more, training to more people? Because if we were to send people, we could send only about 2 or 3. But when they came, they were able to train about 35, healthcare professionals, and they now do a lot of outreach. Recently, I had some funding from Lancaster University. We did 3 activities engaging with stakeholders, including the FDO, Commonwealth, office, stakeholders, healthcare professionals, including student nurses, to catch them young so that they have that kind of, idea about palliative care. And how do we also contribute to the universal health coverage in Ghana as well? As a result of that, we have an abstract from this activity accepted for EAPC conference this year in Prague. And we've also submitted a manuscript on deaf literacy to a journal. Here at Lancaster, I also engage with the young and vibrant medical student. They've set up a Compass Ghana, society, and we had some small funding for them to talk about Deaf Cafe. Just trying to let people be much more aware about deaf. All these activities, led to an award for me, but I think it's kind of a group, especially the trip that we had to Ghana. It was about 9 academic staff who went to Ghana, including 1 person from Compass Ghana, all funded through Lancaster University External Engagement Fund. So I had a Dean's Award, Faculty of Health and Medicine Dean's Award for this activity. So just to kind of wrap up, there've been a lot of advocacy that we've done. We continue to create awareness. You can see here, we've written blogs to EAPC, and some of our blog from Compass Ghana was among the top read, blogs, which we are proud of. Last year we were in Finland to, present at the EAPC as well. And most of this work has also contributed to some book chapters. So one project on my PAL, I did a work on, uh, digital health with colleagues at Lancaster. We published an ebook, and the other two books are book chapters, also work related to, my research and also Compass Ghana as well. Just to kind of wrap up, last year, I was really delighted to be nominated and eventually winning one of the awards for Nottingham Alumni Awards. So I was among 6 of those people who won the award. And I went to Nottingham last year for that award. And I dedicate this award to all the amazing healthcare professionals and colleagues at Compass Ghana and all mentors who made this possible. And in case anybody is interested in studying palliative care with us, and I know I just needed to chip this one in. Sorry if this is not allowed. If people are interested in studying palliative care with us, we are happy to have a conversation on that as well. Thank you very much for your attention, and I'm looking forward for your questions later on at as the other people have presented. Thank you very much.
Thank you so much, Yakubu, for your absolutely phenomenal work in this space. I can see lots of questions coming in for you already, so we'll hang on to those for at the end, unless you want to reply within the chats or Q&As directly. So our next speaker is Dr. Rosalie Magboo. I'm absolutely delighted to be welcoming Rosalie. From her presentation is titled "From Bedside to Breakthroughs: Leading Change Through Research." Rosalie is a matron in intensive care unit at Barts Health Centre, St Bartholomew's Hospital in London in the UK. She is one of the senior research leaders of the National Institute for Health and Care Research, responsible for developing nursing research capacity and capability both locally as well as nationally. She is also a research fellow at Queen Mary University, London. Her research interests include intensive care nursing, health-related quality of life, cardiac surgery, aortic dissection, surgical site infections, as well as Marfan syndrome. Thank you so much for joining us this morning, Rosalie. I'll hand over to you.
Thank you, Ada, for the invitation. Can you see my slides? Okay. Yeah. Very good. Let's just put this on the side 1 second. Oh, apologies. I cannot see my slides now. Sorry. I'm not so used to. Sorry, is my slide coming up?
Yes, we can see them.
Yeah, but I can't see it. Sorry. Yeah, there you go. Thank you. All right. Well, thank you for the very kind introduction, Ada. As she's mentioned, I'm going to be talking about leading change through research. So again, good morning to everyone. It's a real privilege to be part of this launch, The Power of Research. Today, I want to share my journey, not just what I have done, but what research has made possible. And why I genuinely believe every nurse, midwife, or healthcare professional in this webinar has a place in research. So when we hear the word research, it can feel quite distant, quite academic. But actually, research starts with something very simple, a question, as Dr. Yakubu has mentioned earlier on. So why do we do it this way? Could this be safer? Could this be better? And every time you've questioned practice, you've already started thinking like researcher. And research is powerful because it directly improves care, making it safer, more effective, and more equitable. Studies show that research-active organizations have better performance, having a positive effects to both staff and patients. Let me tell you, how did I get involved in research? My journey into research didn't start with a grand plan. It started in clinical practice. And although I had some research background, I was an ICU nurse for more than 25 years, and I'm still is. As a clinical nurse, I noticed the difference in how care was delivered, the gaps in evidence, the patients who deserve better outcomes. And that frustration, that sense of this could really be better, is often where research begins. So later in my career, I decided to pursue a PhD. And if I'm honest, it was one of the most challenging things that I've done. And it's not because of the academic side of the PhD, but because of the mindset shift. I had to learn to question everything, think critically, be comfortable not knowing. And there's definitely challenges in doing the PhD. I had imposter syndrome, I had multiple rejections, I had challenges balancing clinical identity with academic work. However, it changed how I see healthcare completely. I learned that a PhD isn't just about a qualification. It gave me a confidence, a voice, the ability to influence care. And instead of asking, what do we do? I started asking, why do we do this? Why do we do it this way? Or can we improve it? And that is incredibly powerful. And I say it is powerful because from not having any trial in our department, we are now supporting 14 randomized controlled trials since I came back from my doctoral fellowship, 5 of which have been successfully completed. And these are some of the trials that we are currently supporting, both portfolio and commercial trials. As my research career developed, I had the opportunity to take on a wider leadership role, including working as a senior research leader with the NIHR. And that role is really about people. It's about supporting others into research, for example, through the implementation of the NIHR-Associate PI scheme program, or supporting staff to do NIHR research internship or fellowship. It is also about creating opportunities, making research more visible and accessible. And through this role, we were able to provide opportunities for clinical staff to be seconded in research studies. And with the number of randomized controlled trial that we are doing in our department, we pretty much encourage everyone's participation in trials, which is really amazing. And this is important because research doesn't grow through individuals alone. It grows through communities. This is one of the things that I'm most passionate about, helping others get involved in research. But I recognize that I cannot do it by myself. So I established an army of research champions to help me build the network. I believe that research grows through people. In teams, that means making research visible, encouraging curiosity, supporting development, creating opportunities. And with the help of our research champions, we have now established regular research cafe, protocol club, and we publish bi-monthly research newsletter to help increase research awareness and give updates on our research activities. But remember, research can start with something small, a question, an audit, a conversation, and those small steps build confidence. So as a result, we've seen an increase in screening and recruitment in our studies that we're doing. There's definitely increase in the number of studies that we've conducted. We saw a significant improvement in staff engagement with research activities. It's good to see that clinical staff now are handing over who are the patients who are included or recruited or have been recruited into a specific trial. And we have also seen an excellent staff retention as they are now seeing clinical research as another professional pathway alongside education and clinical management. Most importantly, there is a rapid translation of research results into clinical practice, benefiting our patient, our staff, and our organization. This is one of the examples where we significantly cut the translation of research into clinical practice from 17 years to just 1 year. And this is because we have been heavily involved in the randomized control trial that was initially done. And the end result of all this activity is a change in culture on how we view research. Of course, it is not always easy. We're working in pressured systems. There's time constraints, workforce challenges. We have competing priorities. But here's what I've learned. Research active teams are stronger teams. They are more engaged, more innovative, and ultimately deliver better care. As a proof, we have successfully submitted our first nurse-led patent application and have developed a total of 70 QI projects, with some of them informing research or translating research into clinical practice. And I'm very happy because these involve all the staff, from ward clerks, healthcare support workers, nurses, trainees, medical technologists, and consultants. So you might ask me, where do I need to start? If you're early in your career, you might be thinking, I'm not ready, I don't know enough, that's for someone else. Just remember, research careers don't start fully formed. You can start now by just simply getting involved in a project or joining a research team or simply asking questions. I find it really useful to find a mentor. And you can do that from social media, for example, or from your own organization. As Dr. Yakubu mentioned, attend events and conferences so you can grow your network. Connect with your R&D, your research champions if you have any in your organization. Or simply speak to your librarian. As Ada mentioned at the beginning, curiosity is enough to begin. So 2 years ago, we were just curious. Recently, we have completed our first clinical nurse-led trial, which is the Wisdom study. In this multi-center study, we were the highest recruiter in the UK, thanks to all the clinical staff who have helped us recruit and screen the patients. And now we are setting up our second and third nurse-led randomized controlled trial, which is the Romeo and the Rosalie platform. So one of the biggest lessons I've learned is this: say yes even before you feel ready. Most opportunities in my career came from saying yes first and figuring it out afterwards. I learned that confidence doesn't come before action. It comes because of it. So here's my take-home message for you. Research turns question into change. It turns evidence into better care. And nurses, midwives, and allied health professionals are absolutely central to that. You don't have to choose between being clinical and being academic because you can be both. And finally, the future of healthcare depends on people like you being willing to step into research. Thank you. These are just some of the resources that is available in NIHR for external training and development opportunities, depending on what part of research you wanted to develop. And we can share that with you as well. So thank you.
Wow, thank you so much, Rosalie. A massive congratulations for being the absolute first nurse-led trial team as well. That is just absolutely phenomenal. And I'm so inspired to hear about all your amazing work, as I'm sure all the listeners will be too. I'm now delighted to move on to our third and final guest speaker of today, Dr. Zena Aldridge. So Zena is a registered mental health nurse whose career in health and social care has spanned 4 decades. Zena holds a master's degree in mental health and a PhD in nursing studies. She is also a clinical academic who holds a portfolio of roles, including National Institute for Health and Care Research with the Nursing and Midwifery Office Associate Director for Social Care. She is an independent dementia nurse consultant and also a consultant editor of Nursing Older People. Last year, she was awarded an NIHR Senior Clinical Practitioner Research Award. She is also a Queen's nurse and in 2024 received a Chief Nursing Officer for Adult Social Care Gold Award for her services to research and dementia. Zena, I'm delighted to welcome you. Thank you for joining us.
Thank you, Ada, and it's great to be here, particularly today of all days. But I have to say, following on from my previous speakers, I'm going to take a step back and go, well, how do we start on this journey? Because one of the challenges is, as you approach your nursing career, is as Rosalie pointed out, research may not be a natural pathway. You may not recognise it within your scope of practice. So how do we actually find a way onto that path? I think for a lot of people, it's incidental and accidental, and my story is no different. So I'm going to share that with you because I think as nurses, we can sometimes look at people with titles, whether that be, they're a doctor or a professor or their professional titles and think, how am I ever going to get there? How am I going to start this journey and how am I going to progress? So I always put this slide up as a means of introduction. I've always felt a bit of an odd one out. So I started my career in health and social care working in domiciliary care, so working in people's homes, providing social care support to them. I loved my job. I absolutely loved it. But there came a point where I felt I want to do more. I want to learn more. So I actually undertook my nurse training and I trained as a mental health nurse. And at the time, it was seen as a lesser role than some of my general nurse colleagues. I remember starting at university, being in a cohort of over 150 students, and there was 15 of us that were mental health nurses. And we were always told we weren't the proper nurses. And I found that really difficult because I identified as a nurse. I came into nursing to want to make a difference. And because I wanted to do that through a mental health lens instead of a general adult lens, I didn't see that as being any lesser of a nurse. But my path continued as I went through my training. I was probably the one that everybody really wanted to leave the classroom because at the end of the session, I'd always ask the question, why? When everyone was trying to get out of the room, I would always be, well, why? Why are we doing this? And that kind of became the sense of my practice, actually. I've always wanted to question and be curious and ask those things as to why we do things, why don't we do them differently, and how can we make positive change? And that can feel really, really difficult, particularly because sometimes we don't even understand what research is. And I know we've got sessions coming up later in this series about busting some of those myths and misconceptions. And I certainly had some very strong myths and misconceptions about research. I felt it was conducted in a lab, often by medics. It was something that, was about numbers, measurements, audits. It wasn't about mental health practice. I didn't really understand the nuances and how I could make a difference. So I went into my practice journey and never really gave it a thought, but was still always asking those really difficult questions and wanting to know how I could answer them more readily. There was these kind of lots of soothsayers and people telling me different things about what research was and what research wasn't and how I could answer these questions, but I was still mystified by how I could progress and challenge the status quo, often seeing practice that I didn't understand why people were doing that. They couldn't tell me why they were doing it. And I was actually seen as a bit of a problem rather than a solution. Until I got to a point of my career where I started to read more, I started to engage in the literature, I started to be able to think differently. And this can be a challenge for many people who might not be able to access the literature for multiple reasons. They may not even realise it exists. Often what researchers are really good is writing lots of journal articles that sit in academic repositories, but they don't actually land or get that knowledge mobilized into practice. So it can feel really, really distant. So I started to build a ladder towards that academic opportunity. And I was very fortunate that I wanted to develop as an advanced nurse practitioner. And one, of course, the fundamental pillars of being an advanced nurse practitioner is research. So I undertook my master's to do the sort of very technical elements of my work and the very specialist elements of my work. So I was qualified to be an approved mental health professional. And in the UK, that's about assessing people who are really distressed to see whether they require hospitalisation. It's also, I undertook some best interest assessor training, which again was a very practical element of my role. But as to finish the master's, I was able to undertake my first independent research. And I explored how I could support family members of people who had come into a mental health hospital, because it was often a really challenging point where they didn't get the support they needed. As part of that study, I was able to kind of identify some real practical things that we could do to support family carers, and was able to embed those in the unit that I worked. And it was from there that I really got the research bug. I realized that actually it didn't need to be incredibly big research trials conducted in hospitals or laboratories, that actually research and embedded research conducted by practitioners can make a real difference. I then went on to work for a national charity, Dementia UK, because I specialise in dementia care. And I started to work in the service evaluation team. And then again, I was able to use those kind of research skills to look at the evidence, answer questions, inform service delivery, and change practice in that way. I was getting frustrated though, because I still felt that there were others around me who had skills that I didn't have, and I wanted to have to be able to shift that dial more readily. I wanted a seat at the table. And I was very fortunate, going back to Rosalie's point about mentors, to have mentors who supported me and guided me and gave me the courage to apply to do a PhD. Now, as someone who qualified as a diploma nurse, who'd always felt as an outsider, I didn't see myself as an academic. I still don't see myself as an academic. It afforded me the opportunity to undertake a PhD. I'm still a reluctant researcher. Absolutely, I'm a reluctant researcher. I don't see myself as an academic. I am a clinical academic, which means that I can combine those skills of being a nurse and being a researcher in a different way. And it's really quite empowering to think that you don't have to fit a mold. You can create a narrative and a pathway that works for you and your experience and your skills. So not only do I work with other researchers now to inform and support their research as a clinical academic and a co-applicant on bids relating to dementia care and social care nursing practice, I actually have a role where I can support others to come on that journey. And I think that's really important for those of us who are enabled to be able to throw the ladder down and support other people to embark on a research journey, whatever that looks like to each individual. And I think that's my message from here, is there is not one size fits all to research. It can take on many guises, and there are lots of people in your networks and who will be able to support and guide you. But what it is about is acknowledging wherever we start from, we can all be part of that bigger community of researchers in whatever way, shape or form we decide to do it. I'm going to stop sharing and conclude there, because I'm mindful that we are incredibly tight on time, and there might be people who really want to ask questions of the group.
Thank you so much, Zena, and particularly for offering both a mental health perspective as well as for challenging the status quo. I think it's just, absolutely phenomenal to hear all these speakers and to hear how people can engage with research in such varied and different ways, in different spaces, as well as in such varied roles as well. So thank you all for joining as guest speakers today. We do have a few questions that have come through. So the first question is, what strategies can be used to influence healthcare systems, particularly in low income settings where nursing research has limited impact?
Maybe I can try to answer that. Yeah, thank you very much. I think that's a very important question, but just to kind of take it from the very last bit, I probably disagree a little bit with the fact that maybe it will have, limited impact, because I believe that irrespective of, how small, you make a change within the area that you are, it will have that ripple effect. And just to kind of take Compass Ghana's, journey as an example, I started it alone, and, eventually, I had two people join in, and that has, kind of, improved. And currently, we are also influencing policy, palliative care policy in Ghana, which is being led by the Ghana Palliative Care Association and the Ministry of Health. We're also making input into, the Ghana Chronic Disease Trust Fund. So don't underestimate the amount of work that you can do with your research. That is one aspect of it. And I do also agree that it can be really difficult to, influence, some health systems, because you need, first of all, to understand the health system. You need to work with the people, identify what are the priorities are for them. If you kind of design a solution and you just want to go and bundle it over people, irrespective of how good it is, you may face some resistance. So I think that will be some of the strategy that I can share. Work with the people, through the people, to identify the problem and, involve them right from the beginning to the end. And don't underestimate the impact of your work, irrespective of how small it is.
Could I add to that, Ada, if I may? What I would say is, actually, as nurses, it's really important that we remember that we want to influence that bigger research agenda. And actually, some of the best questions come from practice. So those small pieces of work, those discrete pieces of work, if they're important to you, I would suggest they're going to be important to a lot of other practitioners. And you can create a bit of a groundswell that then informs the research that's conducted at that higher level. So I think absolutely never underestimate the power that can have. And I would also say, find your people. If you're asking that question, there's likely other people are asking that question. And as you kind of come together, you can really become a bit of a tour de force, if you like, where actually that starts to gain momentum. So absolutely, I don't think and also remember the impact it's making at a local level to those people in your care. For those individuals, it's going to be immeasurable, the impact that you have.
Yeah, can I just add to that? I completely agree with Dr. Aldridge. I think collaboration is also very important as a strategy to help widen our research. I mean, we don't necessarily need to reinvent research, because evidence might be available already, and it's just a matter of collaborating or identifying how we can implement those evidences. And if there's no evidence, again, we can collaborate to work together to be able to build that evidence, isn't it?
Thank you all so very much. There was another question around mentorship, and I think we might have covered that in the sense of finding your people is so absolutely vital within this space. Whether it's somebody with that topic expertise, somebody with that relational aspect, that someone that you really get along with and inspired by. Or even someone who's, a real expert within the field that you want to work in as well. I think all of those things are so absolutely important in this space. But I did absolutely want to thank all of our speakers just before we run out of time. And Gemma, would you like to say a few last words before we close?
Thank you, Ada, and thank you to all of our speakers today. I think there's been a real common theme throughout each of the presentations, despite the fact the location, the focus of the research has been very diverse that you've shared. There's a real strong sense of research as a mechanism for influence. So wanting to improve the care that we're able to offer, the conditions that we're able to work in. But also this sense of it starts with a question. It starts with those what ifs, the whys, the curious mindset. And I think both of those things, influence and curiosity, are so central to the themes of the Nursing Now Challenge. And each one of the members of our network are motivated to be here because they share those same drivers and qualities. So I am absolutely positive they will have found your insights incredibly valuable and inspiring today, just as I have. So thank you all so much for getting us off to such a great start with this particular theme of our activity. I'm sure there'll be lots of follow-up questions and further opportunities for dialogue as we progress through, but it's wonderful to have you all here, and thank you again, and thanks to all of the members of our community. I think we reached about 80 at one point that were able to join us today. Thank you all.
Thank you.
Take care, everyone.
Thank you.
Bye-bye.
Bye.